Humberside Fire and Rescue Service are looking to expand their current home safety visits to more formally include elements within a health arena. The following presentation will explain how we are intending to further introduce this and how our partners can get involved. In October 2015, the National Fire Chiefs Council held a conference with health partners, including Public Health England and NHS England. Following this, a national and strategic workstream was commenced titled Fire as a Health Asset. The first intention of this was to expand on a nationally delivered activity by all fire services. For over 10 years, fire and rescue services have been carrying out interventions in people's homes to reduce their risk from fire. These interventions have various names across fire and rescue services, but all are based on similar principles. English Fire and Rescue Services now deliver as many as 670,000 fire safety interventions in people's homes every year. This approach has contributed to a reduction of risk and dramatic drop in demand for fire and rescue services. In Humberside, we have delivered home safety visits between 10 and 15,000 homes per year for the last 10 years. These visits have expanded over that time and broadly follow a structure of gather information, engage, equip and refer. An example of this is our John Doe. John is 67 years old and lives alone. John suffers from narcolepsy. John has had 3 fires at his home. On each occasion, fire service resources have been sent. These incidents have also had an impact on ambulances, councils, and hospital teams. The outcomes of interventions with John led to a multi-agency meeting to share data and mitigate the risk adequately, preventing any further incidents. These principles within this example of a reduction on demand can be more widespread and delivered earlier through intelligence-led, effective delivery of activities such as safe and well visits. A number of fire and rescue services have begun working more closely with colleagues in health and local authorities to explore how the fire and rescue service might work to support them in improving health and quality of life outcomes. On many occasions, the access that fire and rescue services have to the homes of the most vulnerable is seen as a vehicle to complement these improvements, with firefighters facilitating direct contact with vulnerable people on behalf of other agencies. The initiatives arising from collaboration have included falls risk assessments, alcohol and mental health advice and support. These initiatives have proven that there is far more that fire and rescue services can do beyond their current home fire safety role, with the potential value this could add if delivered on a wider health and well-being scale. Wherever possible, an approach of safe and well visits that is adopted should be one of a light touch health check of all individuals in the home, identification of risk whilst there, provision of brief advice, provision of appropriate risk reduction equipment, referral to specialist advice and support where appropriate. Safe and well principles have been nationally developed to include areas such as fire risk, mobility, hoarding, mental health, frailty, falls and smoking, to name a few. Currently, Humberside Fire and Rescue Service have incorporated smoking cessation, winter warmth and falls prevention. A smoking section aims to ascertain levels of risk through a series of questions. The risk will be mitigated. We will also discuss stopping smoking and offer signposting and referral advice to the occupant based on their responses. A winter warmth section is delivered during November to February, considers over 65-year-old vulnerability in cold weather periods. We will then offer basic advice and signposting to the NHS for further information, including on influenza treatments based on the responses. A fall prevention section aims to determine the risk of the occupant falling in the home and details our engagement activities as well as any referrals necessary. We are now aiming to expand on our safe and well visit offering, but need partners' assistance to do so. Collectively, we would like to determine what subject areas are important in Humberside and which of those the Fire and Rescue Service can contribute to. Looking at our contribution with partners, we can then upskill and train our workforce in order to see it and solve it during a safe and well visit, design what information and data can be gathered and shared, how we can best provide a service to vulnerable people, explore opportunities for proactive data sharing, and explore opportunities for commissioned activities by an upskilled workforce.